Hi there. I'd like to ask for your help with something. So, this is a piece of information that I wish every woman had access to. So, please share this video with your friends or any woman that you know that is concerned about breast cancer. Unfortunately, 1 in 7 women will be diagnosed with breast cancer in her lifetime. And there's one thing that I have run across in my research that is so simple and profound that I don't know why this isn't part of our standard of care when we're dealing with women's health care. And that is maintaining an adequate vitamin D level. So you've probably heard a million times how important it is to have your vitamin D levels checked and maybe take vitamin D and all that kind of stuff. But I just want to encourage you to be a little more diligent about it and a little more specific, and we'll get into that. So I am going to post, this is the topic of my blog article this week. So you can visit drjeni, drjeni.com, and read the blog and I'll link to this article. But basically, there was a PubMed journal article published, which is a very reputable medical journal. And the study was something to this effect, where women with the lowest vitamin D levels, which were measured on a blood test of 13 and lower is the value that they had, compared to women whose levels were highest, and that was determined to be 52 and higher, then their risk of developing breast cancer was double. The ladies in the lowest vitamin D levels. So that's huge. Share that with everyone you know and have them have their vitamin D levels checked. The only way to know whether you have adequate vitamin D is to have a test, and it's a blood test. It's simple. You can even do it a finger stick if you don't have, if you don't want to get your blood drawn. But anyway, just knowing that's like one huge piece of the puzzle, I think, with so many chronic diseases, and is just having adequate vitamin D. And this notion that we'll just go out and buy some vitamin D and start taking it. I want to caution you against that because number one, not all vitamin Ds are created equal. I test a lot of people and work with them, and some people are taking vitamin D, but they're not taking a source that their body absorbs or does anything with. So it's not doing what they think it's going to do, number one. And number two, vitamin D is a fat-soluble vitamin versus a water-soluble vitamin. That means that you can actually take too much. It will store in your fat tissues, as opposed to water-soluble vitamins like your B's and your C's, where you take too much and you just urinate that extra out. So you do want to maintain a healthy level, and I think the right answer in healthy levels is between 50 and 75. When you get a blood test, that is the therapeutic level that I see in my research that says it's protective against a lot of things. So anyway, I wanted to pass that along. Just share that with your friends and the women in your life that you love, because that is just a super simple thing that we can be doing that dramatically helps mitigate the risk of breast cancer, which is not something that anybody wants to deal with. So thanks for watching. Have a great day.